About Olivia. Olivia is a 22-year-old lady that was so much in love with Kelvin. But then, after a while, Olivia got pregnant, and Kelvin denied the pregnancy. When Olivia delivered the baby, she started having this mood swing. She cried a lot, called it crying spell. The mom thought it was because her lover broke up with her, and it was normal. But then when she got home, she lost appetite. She couldn't bond with the baby. She had this extreme mood swing. She lost interest in activities she enjoyed doing before. And then, after some time, after some weeks, she started hearing voices in her head telling her that the baby was a misfortune. The baby was the reason she broke up with her lover. After some time, she actually came to believe that the baby was a threat to her. The baby was nothing but a misfortune. Then it progressed. She started seeing people trying to kill her. She felt everyone was watching her movement. She felt her mom was watching her. She felt the neighbors was watching her. She felt the baby was an enemy. She started seeing the baby trying to hurt her. And on a very good day, her mom walked in on her trying to stab the baby. And then the mom thought it was because she was trying to kill the baby. But then Olivia was actually trying to defend herself from the baby. Then after the next week, Olivia's friend Lucia visited and then saw her trying to kill herself. That was when she called the attention of the mom, telling her this is not just about the baby and it's not just about the breakup. I think Olivia needs help. That was when they went to the hospital. And then Olivia was diagnosed. She got now, before I unveil what Olivia was diagnosed of, I want you to please subscribe so you don't miss out on any of our videos, of course, our future videos, so you don't miss out on any of them. Olivia was actually diagnosed of postpartum psychosis. Of a truth, there are several mood disorders that moms, new mom, go through. So now I'm here to tell you signs and symptoms that you should, when you see this, maybe in your wife or your mom, your sis, your aunt, whomever the mom is to you, you should know that this is not just mood swing. It's not just the trauma of childbirth, that this is postpartum psychosis. We have some mood disorder that comes after childbirth. We have baby blues, also called postpartum blues. This goes away on its own. It's usually when the mom cries a lot. We call it crying spells. And then she has this mood swing, loss of appetite at times. But then this goes away on its own. And then we have postpartum depression. That's when it comes down to losing interest in activities they enjoy doing the most. They find it difficult bonding with the baby. They are agitated, aggressive. That's postpartum depression. But then this postpartum psychosis is a more severe form of postpartum depression. Postpartum depression. So now, what are the symptoms to look out for? What should I know that this is actually not just normal? What are the symptoms I should see in a new mom, and then I know that this is not just normal? Remember, postpartum psychosis, there's risk factor of having this postpartum psychosis if you're between the age of 18 to 25 and mostly first time moms, that's primo gravidas. But then this doesn't mean that if you're not between the ages of 18 to 25 or you're not a first time mom that you can't possibly have this postpartum psychosis. It can happen to any mom, but the it can happen to anyone. So now I would like to tell you the symptoms you should know, you should see, and then you know that this is not just about the trauma of childbirth. The first one is hallucination. Remember, Olivia heard voices. Olivia saw things. She saw train. She saw the baby trying to hurt her. This is called hallucination. It's kind of when people start seeing things that are not real. Sensory perception of things that are not real. They hear voices that are not real. They see things that are not real. And then we have delusion. This is a forceful belief they start having. They start having this belief, just like the case of Olivia. She had this belief that the baby was a tragedy, nothing but a threat. And then she believed it was delusion. She was believing in things that were not real. She was believing that the baby was after her life, the baby was this and that. And then we have paranoid. Paranoia, this is when a mom becomes paranoid. She feels that everyone is watching her. People are watching her. The mom is watching her. She becomes scared. Sometimes they become conscious. Sometimes they become over conscious. And these are people that have babies to look out for. We also have extreme mood swing. You see someone, she's happy, she's laughing, the next minute she's sad. We also have this insomnia. We have in some cases they sleep a lot, they don't have insomnia, they have excessive sleep, they don't even care about the baby, they keep sleeping. And in some cases it's called insomnia. They find it difficult to sleep. And then we have confusion. They are confused. And then anxiety. And then loss of appetite. So these are some symptoms that when you see, mostly the three main symptoms: hallucination, delusion, and paranoia. So when you see these symptoms, please just know that this is not just a phase that is going to pass on its own. Postpartum psychosis is actually an emergency mental illness, but it's very curable. It's curable. Once you get treatment, it's curable. But then you don't just look over it. You don't just say, "Oh, this she's just going through heartbreak and nothing else." You should know when it's serious, because it can lead to suicide. They start harboring the thoughts to kill themselves or the baby. Start having these thoughts of harming the baby, of harming themselves. Okay, so now see you next time. Please subscribe if you haven't. Thank you for watching today's episode. Bye.